So for pushing during childbirth, what we really want to do is have these pelvic floor muscles lengthen and open and relax during the pushing phase. Our uterus up top has muscles that will be contracting to push the baby down. So during the pushing phase, we need those muscles to be able to contract during the contraction, and then these pelvic floor muscles will be opening and lengthening to have the baby come through. So we can do that through two different ways. The first one is closed glottis pushing, and that means that we're holding our breath and pushing down, or what you probably are used to seeing in the movies and commonly hear about from other people. The other way is open glottis pushing, which means we have an open airway, or we're exhaling, breathing out, while we're also pushing down and opening up those pelvic floor muscles. So I'll show you this on hands and knees position. You can try a lot of different positions for pushing, but hands and knees tends to be a nice one to help open up around the pelvic floor. So you're gonna come over a chair or a birth ball, and you're going to get onto your hands and knees like so, or support it over onto your knees. And so you can already in this position feel that the pelvic floor is a little bit more open and stretched. And so what we're gonna do here first is the closed glottis, and that is gonna mean that we're gonna hold our breath. So we're gonna take an inhale, and we're gonna think about breathing kind of 360 degrees around as we take the inhale. And then as we hold our breath and push down, we're gonna create a little bit of tension in our belly as we try to make a bearing down or an opening sort of motion. So that's gonna look like, okay, what I'm feeling as I do that is almost like a spreading around the sit bones. It can also help to put one hand around the sit bones or around the tailbone while you do that breath or that push with closed glottis, to feel pressure come into your hand as you push down. Now, this looks very similar with the open glottis. We're just breathing out now. So for some, it can be helpful to think about blowing out on birthday candles as you're breathing, but you can also breathe through the nose if that's better for you. So you're gonna take that nice inhale, 360 degrees around, and then out the mouth. As you're creating pressure around the belly and putting that pressure down and out through the pelvic floor with a nice relaxation. So we're not forcing and squeezing those muscles. We are really trying to let them fully relax and stretch. It should feel again like a nice gentle bearing down sort of motion. And again, you can use the hand over the tailbone or the inside of the sit bone. To feel a nice gentle lengthening of those pelvic floor muscles. You might feel a difference between one or the other, and that's why they're both options for you to have during birth. The closed glottis can be more forceful and can sometimes risk a little bit more injury to the pelvic floor and the perineal area. It can also be a lot more exhausting, whereas the open glottis tends to not have as much force, but can save your energy and can have less stress on the pelvic floor muscles. So finding the balance between the two in a way that works for you during your birth while you are in the pushing phase can be helpful.